right from the breakfast till our dinner, it is majority is carbohydrates.
Today, we are facing an obesogenic environment which is adding to the carbohydrate intake, and that is fueling the epidemic of diabetes and obesity. Contribution of stress and sleep definitely is adding to this vicious cycle. The long sitting hours is more dangerous than smoking.
Is it really something like that? Thin people are safe and fat people are unsafe or something like that?
No.
Hello and welcome to my podcast, The Healing Monk. I am Dr. Suman, your host. Thank you very much for appreciating our previous episodes. Me and my team have been relentlessly working to get you better and better stories, not for noise, but rather to bring some teaching, some change that can be brought into your life very, very silently. If you find value here, then please do subscribe and share it with your family and friends, because health improves only by sharing. In our today's episode, we are talking about something with which we are associated right from our birth, something which makes our food palatable, which satiates our cravings, but at the same time, it fuels a disease very silently, which we fail to recognize or respect until we get diagnosed with a disease called diabetes. And when we get the diagnosis, after that the knee-jerk reaction starts. We stop eating some things, we change our lifestyle, and what we don't understand is a simple understanding about the metabolism of glucose, or in common man's language, sugar, can actually help us in preventing the disease, also to improve our mood, balance our hormones, and live a healthy life. Today, with me, I have a person who has been dealing with sugar or glucose for more than 3 decades. She is a person who has studied, treats, and also teaches about glucose metabolism. She is a clinician par excellence and person with clarity of voice about this particular subject in this world of confusion about health. I am talking about Dr. Mythili, one of the senior most endocrinologist of Visakhapatnam. Thank you, madam, for accepting my request and coming to on our show for the Healing Monk podcast.
Thank you, Suman, for inviting me to this wonderful Healing Monk podcast. I'm really delighted to speak on the key concepts of glucose metabolism. And really, I appreciate your effort to bring scientific information to the common man through this Healing Monk podcast.
Thank you, madam. So how I actually, this concept of today's podcast came in my mind was, I believe we all eat because of our cultural ascent from where we belong. What we eat right from the breakfast till our dinner, it is majority is carbohydrates. And recently I came across a book called Glucose Revolution, beautifully written. She's not a doctor, she's a biochemist, but she has done due diligence of research and written it very nicely about the different aspects of glucose and its effects on our body, and how simple hacks can change it. And I believe a person like you who has been dealing with diabetes at large, which is one of your major patient that you are dealing with, so you are one of the best persons who can take out those concepts and misunderstandings about glucose metabolism.
Sure. Thank you.
So, madam, firstly, I want to ask you, like, we all, let us say you belong to a Telugu family, I belong to a Odia family. So, what do you think about our food habits and how glucose plays an important role in our food habits?
So, as you rightly said, the Indian diet is majority is carbohydrate and it is deplete of protein. So that is the major criticism about the Indian food menu. Especially if you look at South India, Andhra, the Telugu, and even Odisha, all people, majority, it is the staple food is rice. And today, when we say rice is the carbohydrate which we all consume, but what is recommended now is that rice is a carbohydrate with high glycemic index. What we need to take is carbohydrates with low glycemic index, like millets. Millets, by and large, okay, glycemic index is a little less than rice, but they are nutrient sufficient. That is, they have fiber, they have minerals. That is the importance of millets. And then whole grains. So these are something which we need to add to our carbohydrate portion and reduce rice.
So, do you think, like from our childhood, as our mothers who, with lot of love, they will make diet kind of, let us say, upma in the
Yeah.
morning, or idli is common Telugu diet, and we understand about the issue of eating more carbohydrate maybe in the fourth decade of our life when someone gets diagnosed with diabetes. Do you think that we are actually understanding the requirement to minimize carbohydrate intake or to regulate carbohydrate intake quite late?
No, actually, if you look at the 1960s and 70s, that was a period where there was food scarcity, and then we had the Green Revolution. Then we had food sufficiency came. Food scarcity was replaced by food sufficiency. So that was mainly with wheat and rice. So that was a separate era where there was not so much availability of so many vegetables or fruits. Food was a scarcity, and the only thing that we had was rice and wheat. And there was no obesogenic environment at that time. But then today, we are facing an obesogenic environment which is adding to the carbohydrate intake, and that is fueling the epidemic of diabetes and obesity.
In fact, the poor man's diet usually is like, as you said, they take rice and maybe they can't many a times afford dal also.
Yes.
They just take rice with one onion, and
Yeah.
that used to be the staple diet of
Yes.
many of the people.
You raised a very valid point. But when it comes to diabetes, their diabetes doesn't differentiate whether you're rich or poor. It afflicts everyone. And today, when we have a poor person who has diabetes, you tell them to eat 2 bowls of vegetables, 1 bowl of dal, 1 egg, and then limit carbs. So, where does he get the money from? So, it's easy writing a tablet for diabetes, but most difficult part is changing the diet, which they are used to, they can afford. So, you ask them to change the diet, it is not easy. So the era is totally different. Earlier days, I think, now we have a epidemic of obesity, and with the present day problem, the diet has to change.
So, do you think, as you said about epidemic of obesity, so here it comes to my mind certain things like in the Instagram or the social media nowadays, the glucose, so-called glucose revolution, we can tell, or the why the glucose increases, certain hacks they call about. So, uh, in the present day, we undergo a lot of stress, lot of sleep deprivation, and because of the diet, getting obesity. Do you think, in a way, this is a vicious cycle?
Yes, absolutely. Diet, stress, sleep, all these are components of a healthy lifestyle. So we say, when we say healthy lifestyle, we mean the diet we eat, we mean the physical activity, the screen time, the stress, sleep. So all these come into play. So the contribution of stress and sleep definitely is adding to this vicious cycle.
So, how does exactly the let us say the sleep deprived person, how does a person's sleep affects the glucose metabolism, and which in future can lead to diabetes?
When we talk of sleep, there are various sleep disorders that can happen. So people can have low sleep, people can have obstructive sleep apnea, people can have a sleep disruption due to night shifts. Today, everyone, the modern 24 into 7 cycle is they work anytime, and the biological clock is disrupted. So whether the night shift workers or somebody who has low sleep or somebody who has obstructive sleep apnea, all these disorders in common, they increase the sympathetic nervous system activity. They increase fatty acid oxidation. They increase the renin angiotensin system. So there are so many changes that take place
Even
during
cortisol.
the counter-regulatory hormones, the cortisol, adrenaline, all these go up. So all these are responsible for spoiling the metabolic health. So the link is so closely intertwined that then we call it somno-metabolic syndrome. Somebody who has a sleep disorder, if they have metabolic syndrome, so when I say metabolic syndrome, we mean anyone having diabetes, hypertension, central obesity, or high triglycerides. These are all the different components of metabolic syndrome. So when somebody has these problems and then when they have a sleep disorder, so we call it today somno-metabolic syndrome. So the link is so closely associated that sleep disorders, and then similarly stress also. So stress is again a situation where your cortisol goes up, your adrenaline goes up, your growth hormone goes up. All these increase your glucose spikes, all these increase your insulin resistance, and that is again affecting the metabolic health.
Even when we have stress, kind of in response to the stress, our liver will release more of the glycogen, and they will come into the circulation, but they don't have the work to do.
Yes.
So ultimately,
Yes.
they will again get deposited as
Yes.
fat and all.
Yeah.
So that is also another of the mechanism. So in your practice, what is the most common lifestyle issue that you encounter among your patients, which actually causes the problem, but the patient doesn't understand that, or they try to be in a denial?
So it is not one single lifestyle. It is a combination of eating junk food plus lack of physical activity. Today you see the sad thing is that young individuals, children are having a bad lifestyle. Children do not move from their places, and children eat a lot of junk food, and this is causing childhood obesity. This is a major problem. So what is the prevalence of obesity in young individuals? As high as 30-40%. So the major problem is obesity in children, adolescent, youth, and due to their bad lifestyle. The amount of time they spend on screens, oh my God.
But actually, people don't think that this relationship between screen time and our body metabolism and diabetes in future, or obesity, the other diseases, people do not realize the connection. Because I can see that, because even many a times my children, I cannot convince them to take healthy food.
The struggle is really, it's very hard to get over this, but still everyone is doing their bit. The long sitting hours is more dangerous than smoking. That is the slogan. So very, very important is that you have to tell everyone 10,000 steps a day, 100% is important.
So coming to this, as you told about steps, there is one hack we all come about or hear about is walk after uh, you take your diet. So how important is that? Like after taking every food, should we take like 1,000 steps or something like that? How does the metabolism affect, and what changes you have seen in your patients who do that diligently?
Again, a very important question you have raised. The reason is when we eat food, so we ingest glucose. Whatever we eat gets converted to glucose. And 70% of this glucose is taken up by the muscle. So the major organ which takes up glucose after we eat food is muscle. Having a good muscle mass, having the muscle exercise definitely lowers your glucose. So as you said, if you exercise after eating, the muscle takes up the glucose. So there is insulin, there is glucose. Happily, the muscle takes up the glucose. Your blood glucose levels don't spike. So this is actually, that is the reason why now people are focusing on muscle strength. So good muscle mass, muscle strengthening exercises, and especially after you eat food, definitely for people who have pre-diabetes, definitely this, tends to lower their glucose spikes.
In fact, I just remember now one thing. My mother-in-law used to have severe diabetes. Her sugar used to be in the range of 400, 500, like that. So once it was a time when we were titrating the dose of insulin and it was not coming down. So one of my very close friend, my MBBS time roommate, is a endocrinologist in Berhampur. So I asked him what is happening. Then he told me one thing. She's taking insulin. She's taking the diet as per our advice. But maybe what is happening is after the diet, that insulin is not being used. So you make her a habit of making her to walk in your corridor, at least 10 rounds kind of thing, and let us see. And this is practically, I personally had seen, she did that after lunch, after dinner. Will ensure that after taking the diet, she will go in the corridor at least 3-4 times, just simple slow walk, and miraculously the glucose dropped from 400 to less than 200 in a period of 1 week.
This is how exercise improves your insulin sensitivity. So it reduces insulin resistance. So one way by whatever insulin you give, you want it to work. This is one of the tips we can tell patients.
Exactly, madam. And people think that suppose they are taking fat, protein, red meat, that is the only contributory for heart disease. So one question that I want to ask, in fact, I want to convey to the people, that is taking more carbohydrates also contributory to developing heart disease, especially we are seeing heart disease in the young now. So how carbohydrate or glucose contributes to that?
Again, the whatever we eat is, most of it is carbohydrate. What we need to ensure is low GI carbohydrate. So when you are replacing your rice with vegetables and whole grains, you are taking a carb which is going to absorb very slowly. When you eat rice, immediately it is absorbed. So the spike occurs. So whereas when you are eating low GI carbs, there's a slow absorption. So once the absorption is slow, there is no postprandial glucose excursions. And that is again, postprandial glucose spikes are associated with cardiovascular events. So that is one reason why you can't take high GI carbs in large amounts. And then more of same thing with, of course, fat and red meat and all, they have protein. Protein and fat are, the spike occurs a little later. So the postprandial glucose excursion occurs first for carbohydrate. So if it is protein or fat, they do produce a spike, but it is at a later time.
So here we have spoken so much about spike. Now let us tell our audience, what is a glucose spike?
Again, glucose is the fuel which all cells in the body need for survival. So normally glucose is in a range between 70 to 140 milligrams per deciliter. So this is a normal range. So when we don't eat, like fasting, before lunch, before dinner, the values are somewhere between 70 to 100. Then when we eat, the values increase by 50 milligrams. So they go to 130, 140. So the range is between 70 to 140 milligrams per deciliter. And when the glucose values go beyond 140 milligrams per deciliter, then only we say it is beyond the normal range. Now, what keeps the glucose in this range? It is the type of food you eat. Suppose you are eating a pastry and then a pizza and a pastry, which are full of maida. Immediately the spike goes beyond 140. Suppose on the other hand, you are eating a salad and some rajma or chana or something, the spike doesn't occur so far. So number one is what is the food you are going to eat, and number two is what is your insulin production like. If your insulin, the beta cells of the pancreas, if they're absolutely working normally and they're producing insulin normally, you will not have a spike. Because the moment you eat a food, the insulin comes into play and then it reduces the blood glucose. So number one is the food, number two is the defective insulin secretion. Both of them will produce a spike.
So basically, when we take a sudden, when our intestines get completely, the glucose gets there, they will get absorbed into the blood, and suddenly the blood glucose level increases. So that is basically called the glucose spike.
Yes.
And this glucose spike, as you said, that they are basically harmful for our cardiovascular risk or even diabetes. So tell me one thing, madam, how we can control the glucose spikes?
So number one is improve your insulin sensitivity. All of us will have insulin resistance. So reduce your insulin resistance. How do you reduce your insulin resistance? Maintain your weight and exercise. So if your insulin sensitivity is good and your pancreas is producing insulin normally, if both of these are occurring, then you will not get a spike.
So basically the glucose spikes are kind of warning signals.
Yes.
And which we are kind of completely ignorant about the glucose spikes. We keep on taking the food.
Yes.
And there are certain hacks also, or there are certain ways. One of them you said about taking more of protein or taking more of the what you call the...
the diet should have 50% carbs. It should have 25% protein. It should have 25% fat and fiber.
Okay.
Say around 3 to 4 grams of fiber. This is what is recommended. And what about the sweetened, the fine sugar? Less than 5% of your total calories is the recommendation. So in a day, if you're taking 2000 calories, so you cannot take more than, you're less than 5% of your total calories.
As glucose,
so you
sugar.
Can't take more than, so it comes to around 50 calories, maybe not more than 10 grams. Not more than 10 grams of your total. That is, you can only take 10 grams. Half a tablespoon is what is recommended in a day. But again, in India, this consumption of sugar is very high.
Yes. So normally, let us say in a Telugu family or Odia family, we take rice as our lunch, and we have some curry, and rarely we have some salads and all that. So tell me the best way that you would recommend, which can keep the glucose spike under control after the food, and like let us say something that we normally eat where the spike increases, and what should we do that it should come down?
So that's why today we have the plate model. So when we have a plate, we divide it into half. Half your plate should be vegetables, and the other half is divided between rice and protein. So you need 2 bowls of vegetables. You need 1 bowl of protein. That is, it is for a vegetarian, it is paneer or dal or mushroom. And somebody who eats non-veg, it is either egg and fish, right? And it is only 1 bowl of rice. So it is 1 bowl rice, 1 bowl of dal or egg, 2 bowls of vegetables, maybe 1 bowl of curd. So altogether, you can take all this, limit your rice. So I keep telling my patients, people will think you are mixing vegetable in rice. No, do it the other way. Take vegetable, mix little rice.
Yes.
Yeah, reduce the rice quantity. And people think eating rice in the night is bad. It's not that you have to eat only chapati, you have to eat only millets. It is nothing like that. It is you increase your quantity of whole grains and vegetables and reduce rice.
Even there is a concept of sequencing, like the book I was telling you, Glucose Revolution, which I was reading. The lady had written there that we should eat fiber or protein or fat first, then go to the carbohydrate. The reason what they have told is that, suppose let us say our stomach is like a basin, like a wash basin. So when we are putting the carbohydrate first, it is getting absorbed and getting into the intestine, and immediately the glucose spike occurs. But if we are taking the salad or fiber things, or let us say we are taking the protein first, it forms a coating over our stomach. So that reduces the gastric emptying of the glucose. So the glucose reaches the intestine, but it reaches little bit slowly. So which again causes a reduction in the spike. In fact, this thing also, I have asked few of the people who used uh, continuous glucose monitors, CGMs, and they have also told that yes, they could see that change. So what is your point on that?
Now, I think, eating fiber and protein, first, it increases your satiety.
Yeah.
It increases your satiety. So when the amount of carb you are going to eat is going to be less.
Right. That is also another positive point.
Because whatever we take, suppose you take, dal, it's a mix of both protein. It has less protein, but it has more major, but it has both. So when we eat a mixed meal, it is difficult to say that we are eating protein first, because it's not totally, we cannot separate it that.
Does this glucose spikes also add to our daily behavior, like our mood swings or our what you call, suppose one person normally our breakfast will be something where we take complete carbohydrate, that is our common. So there will be a glucose spike, and after a spike there will be a sharp fall also. So majority of the time, let us say we are having a breakfast at 8 o'clock, by around 12 o'clock when we are kind of hungry, our performance level also reduces. Do you see that in your clinics?
No, that is, I think, in people who have diabetes, and if they get a hypoglycemic episode, maybe this happens. Not in healthy people. In healthy people, no.
Okay. So, it won't make much difference in that.
Because, the range is there. It is between 70 to 140. People, I do agree with you, but because, people keep telling us these issues, but then in a range between 70 to
again, scientifically, we cannot point it out.
So they will tell my glucose is 95 at that time, and I had a dizziness. So in people who have diabetes, definitely yes, a sudden lowering of glucose can produce some mood changes and all this, but in healthy people, no. And especially if people with diabetes are taking medication, so that also contributes to a sudden lowering of glucose, and that can have a effect on mood and behavior, probably telling us that he has a slight hypoglycemia.
So normally, like as I told earlier, that our breakfast is mostly carbohydrate. As a person who deals with diabetes or sugar, what is your recommendation for the best healthy breakfast for our community?
So, the foods that are made with grains, pulses, they are very, they do not really spike the glucose so well. And in South India, where people eat idli, I think the pulse component, the moong dal should be, that is fine, but then you have to steeply reduce the suji that you add there. Or people are now replacing that with oats to reduce the GI index. And the best thing is to have with all these dals are put together, and then they make some dosa like thing that also is supposed to reduce. Egg is a very good
Omelette or
omelette.
something.
Omelette doesn't spike. So having an omelette, maybe one bowl of salads and sprouts, and then having 2 idlis, that's also not bad.
So
Idli
it's
is it idli? It's not that you cannot eat idli, but you have to
add
reduce the
something.
portion of the
Carbohydrate,
people
high
eat
index
4
carb.
and 5, so that maybe it leads to spiking of glucose. But then when you take it in moderation, and when you add an egg, and then you add some whole grains to it, it's acceptable.
So it's like we should kind of like when we go to a 5-star hotel, they add a lot of along with the food, they will add a lot of what you call the some things to
Yeah.
make it more beautiful and all that. Similarly, in our breakfast diet, we should add certain other things more than the carbohydrates.
Yes.
Like suppose we are eating, let us say, oats. Oats is majority starch basically. So there.
So people add nuts, all this.
Yes,
Yeah.
we should add nuts.
Nuts and seeds are what they add. And then sprouts, you can add them in anything.
Even
And,
chia seeds.
yeah.
Chia seeds is something which is recommended. So those things we can add into the glucose,
Yes.
which can actually be a healthy breakfast.
Yes.
And as we can connect to our own
Yes.
cultural association of the.
Very important now is when we are talking to patients, we have to respect their culture.
Yes.
Since you brought out this word, we need to suggest as per their cultural preferences.
Because let us say in Odisha we take poha as one of the major breakfast, which is a poha with curd and what you call banana.
Mm-hmm.
So that used to be our breakfast, and it's full of carbohydrates.
Yeah.
So another thing is early morning in the empty stomach. People will get up and they will just take a banana or something, because we are completely kind of empty stomach for nearly 8 hours before that. What should be the first diet of an individual which is recommended?
I don't think scientifically there is nothing like it. See, when you talk about banana, let me tell you, 100 grams of fruit is what is recommended for all of us. And people think banana is bad. No, banana is not bad.
No, I'm not telling that.
So, if you eat a banana one day, you can eat guava another day, you can eat apple another day. And whatever it is the moderation which we need to follow.
No, my point, madam, is what should be the first diet after getting up? Like normally we see our mothers or ladies in our families, what they do is they will get up at 5 o'clock and they will have a tea, which is our common practice. We take tea, which is, again, I feel that empty stomach, we are putting a hot tea is a bad idea. And then after that, they will have their breakfast after giving food to everyone in the family, maybe around 9:30 or something like that. So that is what I want to ask, that as a common lady, what should be the first diet of an individual after getting up?
Yeah, I don't think we have any scientific, data or evidence to say that this is what we need to follow, or that is something to avoid. No. So I think just your cultural preference.
But we should take it in time. So the message that I want to actually give to the audience is that our mothers, our wives, ladies especially, they have been they keep themselves empty stomach for more than around 12 hours in the day, and majority of them have what you call gastritis and other problems, and that is one of the regions that should be avoided. They should eat drink water in the first after getting up, and then take something as maybe banana or some diet, so that it should not be an empty stomach for longer period of time. Because in our commonly we see our patients, especially ladies in their 40s and 50s, we see them, they are kind of being empty stomach for a long time, and they complain with.
Absolutely. When you don't eat for long hours, definitely you feel more hungry, and then you tend to overeat, and it happens.
So that also is, we don't eat in time. That sequence of taking food is also a very, very important thing, because that also will change our glycemic index and will cause that craving for the food. How does the craving for the food affect our glucose, madam?
Yeah, it does affect. Binge eating definitely influences your glucose values. Now, since you said about time, one thing I wanted to mention is about the eating outside the biological clock. This is a big problem which we are seeing today. So all of us have a day and night cycle. There is a circadian rhythm. And biologically, the daytime is supposed to be active. It is the time where we need to eat. And the night time is the resting time. Because of the 24-hour cycle now, the modern day cycle is in no night, no day for as far as work is concerned. So the eating habits should be limited to the daytime. Better to avoid eating during the night times, because as it is, working in the night time definitely alters your circadian rhythm, and then your hormonal changes take place, obesity sets in. And when you add eating to that in that point, so you are again perpetuating a vicious cycle. So eating, as you mentioned, eat on time. So when you're active, eat during the daytime. Don't eat during the night time.
So night time, like dinner, which we tell supper or dinner, what should be the ideal time before sleep? What should be the gap? Anything that you would recommend?
And definitely there is so much information today, and there is so much evidence that eating early is important, because your counter-regulatory hormone drive, everything, by the time you sleep, your total body is in a resting state. So if you are eating late, your glucose has to oxidize, and then all these hormonal changes do have an impact on metabolic health. I think maybe 7 people are eating at 6 now, 7, they're eating only twice daily, they're eating morning 7 a.m., evening 6 p.m. Fine. But then it's not possible for all of us to follow that. But there is evidence that having early dinner is indeed good for weight reduction, good for improving the metabolic health.
Even for good sleep.
Good sleep also.
For good sleep, there is a 10-3-2-1 rule.
Mm-hmm.
So 10 hours before you should not take coffee.
Mm-hmm.
3 hours before you take your food.
Okay.
2 hours before do not do any activity.
Okay.
And 1 hour before don't see the screen.
Nice.
So 10, this is
10, 3, 2, 1.
This is a rule. This is something I read somewhere
good.
About sleep.
Very nice.
We hear a lot about what you call that someone who is thin, and we feel that they will not suffer with diabetes. Is it really something like that? Thin people are safe and fat people are unsafe, or something like that?
No, not at all. This is not true. Today in India, the biggest problem is lean people, young people getting diabetes. So metabolic health is different. Your BMI is different. Your body weight is different. They don't, to a large extent, to people who have overweight and obesity do have metabolic issues. That is true. But then the reverse, that somebody who is lean doesn't get all this, is not true. So diabetes, again, it's not one size doesn't fit all.
One size doesn't
fit all, because there are various types of diabetes. You have diabetes in obese people, you have diabetes in old people, you have diabetes in young people, you have type 1 diabetes. So in lean people, the type of, when they get diabetes, the type of diabetes is different. Even in lean people, they have shown that insulin resistance exists.
So how that can
So the pharmacotherapy differs. When it comes to lifestyle, it is same. All of them follow the same lifestyle advice, but then the pharmacotherapy is different based on the body weight.
So pharmacotherapy will come after the diagnosis, in fact. But I think even lean people should understand and should take home that the things that we discussed
they
about
need
the
to
diet.
Have a healthy lifestyle. Absolutely.
Diet and healthy lifestyle, exercise. In fact, the thin people think that they don't need to do exercise.
Yes. Actually, diabetic diet is a healthy diet.
Yes.
There is nothing like a separate diet for people with diabetes. A healthy diet is what should be followed by all of us to prevent diabetes, and for people with diabetes also, so that they control their glucose.
Many times the people who are very active in exercise or kind of marathon runners or all that, they still sometimes they get, I'll tell that majority of the times they don't, but sometimes they get the diseases like diabetes. Because is it only insulin resistance or something else?
Diabetes is it's a polygenic disease. So we really don't know which genes, but there are so many genes that have been implicated, and then of course the environmental factors. So it is definitely, to a certain extent, it is doing with genes.
So environmental factors,
yes,
what
because
can
be? Environment is the obesity. If somebody is who is genetically predisposed to get diabetes, father, mother, everyone has, and then they don't want to get, they should avoid putting on weight. If they maintain ideal weight, to a large extent, they can prevent or postpone diabetes.
And someone who has diabetes getting into good kind of exercise like running or cycling, so that can actually help them to reduce the even many people get cured with it.
Yes,
they don't need medications. If they are getting, one of my friend who is now a complete marathoner runner, so he was, when he was our MBBS friend, he used to be fat, nearly 100 kgs and all, and now he is I think 65 kgs and runs a half marathon in less than 2 hours, 21 kilometers in less than 2 hours. And he had diabetes and everything diagnosed during our MBBS time, and now he is free of all medications.
So this is what we call diabetes going into remission. So today, I told you, diabetes is not one entity, it is various types. If you look at what we call the type 2 diabetes, which occurs in obese people, it goes into remission when they lose weight like this. So from 100 kgs, he has gone back to 65 kgs, diabetes goes into remission. Great. It's not reversal, but it goes into remission. But then again, when the moment he goes back to 90 kgs and all, again he will need medication. So diabetes can go into remission and may not need medicines for some people who have a very healthy lifestyle.
So people also very much follow. See, we as human beings, we try to do things which are easy, or which we feel that it is easy. And so doing exercise is a tough ask for everyone. Getting up early in the morning is a tough ask. So majority of the people, they do is something called as a intermittent fasting. Do you say that intermittent fasting is good, or having long hours of gap between the food is good? What is your point on that?
So intermittent fasting has, there are various types. Eating alternate day. The best thing people do is eat morning and night only. They give a gap of at least one between two meals. One is 8 hours and then the other is 12 hours, so 14 hours. That is the way they eat. So what happens is, there is a period of fasting, there is a period of eating. So when the individual is fasting, right, suppose evening after 6 o'clock, he is not taking anything till morning, say 9 o'clock. Right? During that period, his body uses, there is no glucose from outside. So the body tries to use the fat. The fats are converted into ketones, and the ketones are the fuel. Then when he eats in the morning, he gets glucose. Then the glucose is the main oxidative fuel. So the fuel is different in fasting and after eating. And this is a metabolic switch. This is called metabolic flexibility. So the body, there is a cellular adaptation to the various fuels. And this had very good impact on weight reduction, on decreasing the inflammatory state, everything. There were very good benefits associated with the insulin sensitivity improved with intermittent fasting.
So it is recommended.
Yes, it is recommended.
It is recommended, but it should be done with a kind of a planned way.
Yes.
And
Yes.
Under guidance kind of.
We are seeing many who are doing intermittent fasting and then of course maintaining well.
And some people follow something called as keto diet.
Keto diet is it's not recommended, and then it is not feasible also in the long run.
So what is the keto diet basically?
So the keto diet is where totally you avoid carb. So and then you only take the fatty food, and then it is only the ketone that is the fuel. So we did have some adverse consequences with the keto diet. It is not possible and it is not recommended.
It will have bad impact on the kidney also.
Yes.
Another thing also, people what we see is certain, let us say it can be a marketing thing by many of the people who want to reduce weight. So what they do is that they will give food as per this is this many calories, this is this many calorie. So what is your recommendation? Should we see the food in terms of amount of calorie, or it doesn't make any difference what calorie you are eating, rather you eat good amount of food?
Calorie restriction is important. It is important. The total calories are important. Of course, when you are taking certain amount of calories, so when you are taking 1800 calories, 900 calories should come from carbs. Right. And then 450 calories has to come from protein and 450 has to come from fat. So that balance we have to maintain. So we need all three.
So it is not important that you are eating less calorie or more calorie, but you have a balanced calorie intake.
By and large, it is calorie restriction. So carbohydrate, fat and protein are called the macronutrients.
Yes.
People looked at all these options, whether protein is good, whether fat is good, whether carb is good. And ultimately they said whatever the macronutrient you are taking, it is to be taken in moderation. Right. It is not just only having keto diet, there is only fat or only high protein diet. No.
So another important point that we hear is artificial sweeteners like sugar-free, which is commonly available, and diabetic people will prefer sugar-free. And do you think that is recommended?
No, absolutely no, because I usually tell my patients, if you are really so worried about the bitterness of tea or coffee, just have a pinch of sugar, that's fine. But artificial sweeteners people are using, they do have a lot of concerns. And then they said that they have metabolic health has been disturbed. Then obesity was reported. So large amounts, definitely no.
So India is kind of a diabetic capital nowadays. And in the present day, so what you would advise the common man that what they should do so that they can control their glucose index and prevent diabetes from coming in their late 40s?
So, we have a very large population. So definitely we have the huge chunk of people with diabetes in the world. So because 1.45 billion, definitely we have huge numbers with diabetes. And unfortunately, it is in young individuals. It is in children, adolescents and youth, which we are, this is really a huge problem for the country, for the treating doctors and for the families also. It is to do with the lifestyle. I think parents have to see that, I keep telling a small mnemonic, 5210. So when I say 5, I meant 5 servings of vegetable and fruit per day. So when a serving is 100 grams, so in 5, 4 is vegetables and 1 is fruit. Okay. 2 is less than 2 hours of screen time. So yesterday I had a boy in the clinic. I asked him, how much is your screen time? He said 5 hours. So I said, reduce it to 2 hours. 5 to 1 is 1 hour of physical activity. Recommendations are very clear that 1 hour of good physical activity is recommended for this thing. People think children don't have to exercise. As you said, lean people don't have to exercise. It's wrong. And 0 is 0 junk food. So my thing is 0, I think, but this is easier said than done. It's not possible. So the junk food is the main culprit, and inactivity levels highest in, again, Indian.
So basically, even another mnemonic that we can tell for the parents is to, in order to avoid stress, snacks, and screen.
Yes. Everything is yes.
So that thing we can advise to our
True.
people, and it is this is not a restriction. Rather than that, for our children, this is a protection.
Yeah. Children need to be protected from metabolic disorders and cardiovascular disease. I think for that, I think if children are easily malleable, when we educate them and we tell them, and if parents are role models, definitely they will follow.
In fact, we parents are only taking them to McDonald's and all that, and we are responsible
So
to a bigger
parents tell
extent.
us, ma'am, whole week he's studying and we are giving only home food. Only once in a week we are taking him to the restaurant.
Once in a week is a big.
That's enough to spoil his.
And biryani is one of the biggest source of carbohydrate.
So the way, you see crowds at restaurants, the way people eat the food, I think food is the main thing, and physical activity. Both Indians are eating more, they are moving less. So we need to eat less and move more.
Similarly, I tell my patients, like, our body is like our child, and if we don't tell our child about the good and bad during their formative years, in the future they are going to be harmful to us only.
Absolutely.
And that is like our body, whom we don't like nowadays, smoking or tobacco or lifestyle, obesity, all these things, they are the cause of future cancer, or PCOD is one of the most common that we see, and they're all related to the diet that we take from the childhood. It is not something that comes at the age of 20. PCOD comes one after marriage. We see that the girl is having PCOD. It's not that it has come right that moment. It is something that from the childhood, that the food they have been taking, and I believe the parents and they should be more vigilant about it and careful about this right from the
So all
childhood.
this, yes, definitely, all this doesn't come overnight. You have to, healthy lifestyle is, it's a continuous effort. It's not a, people think one day we have done, that's fine. And
Which one food in our, let us say, common habit in our Telugu community, which one food you would say that don't eat?
sugar.
Means you mean the sugar granules?
Yeah, sugar granules, because especially you have tea and coffee anywhere in India, it is fully loaded with sugar. The amount of sugar they put in tea
Already
and coffee,
it is filled with sugar.
It is filled with sugar.
And we are
Definitely
adding it.
we are.
So some people say that brown sugar versus white sugar. What is your take on that?
I am not sure. I think there's not much of a difference between the two. This is only, satisfaction, self-satisfaction. You take brown sugar, okay, you're fine. But I don't think so.
Before we end, what is your message to the viewers that you would say in order to have a healthy life without diabetes, that they should follow at least from the age of, let us say, 25 to 30?
So, work-life balance. This is what is being talked today. So 25 to 30 is an age where you definitely need work-life balance. And then today we have so many behavioral techniques, so access to so many behavioral techniques which control mind, which really improve your physical health, help in weight reduction. I think all these, it may be yoga or it may be, going to a gym, all these have to be followed. And most important is avoid putting on weight. If you maintain your BMI, if you are 65 at the age of 25, you cannot afford to be, more than 5 kgs at the age of 50. So if you maintain your weight, I think 50% of the problems are, especially the non-communicable diseases. It may be cancers, cardiovascular disease. I think weight maintenance is important.
Thank you very much, madam.
Thank you.
For making this complex topic very simple, and I'm sure our viewers would love and would definitely take home a lot of message from it. And hopefully, if I think from our viewers, one person also changes his lifestyle, his habit, I think our aim of sitting together today will be achieved.
Thank you, Suman, for giving me this wonderful opportunity to share my thoughts on diabetes, obesity, and lifestyle disorders. I wish everyone stays happy and healthy, whoever is listening to us. And thank you once again. Thank you.
You can wish our viewers a happy new year. This will be released in the...
Wish you all a very happy and wonderful 2026. Bye.
Thank you very much for hearing this till the end of the discussion. And again, I'll request you, if you find value, if you think that something that you are learning from this discussion, which you could change your life, which you can change as a habit, then please do that. Start that immediately. And share this with any of your friends or family, because health improves only by sharing. Diabetes is not a disease, it is a condition that we actually garner over a longer period of time. So we should take care of our children, help them to have healthy diet, help them to have more and more better healthy habits like exercise. And these things can make them a better individual and better healthy person. Thank you very much from the entire team of Healing Monk.